Community hospital had a fundraising department within it. A year or so ago, they realized there was a lot more opportunity for philanthropy to have a bigger impact on both the hospital and the community if they took that operation out of the hospital and created its own entity. And so they can do the work that they need to do, run a hospital and run community health programs, and we can focus on maximizing the philanthropic opportunities that are out there in this community. One of the things that excited me most about coming here was the fact that the hospital wanted to have a keen impact on the entire county. We have great partners in Natividad and Salinas Valley Memorial Hospital, but there are a lot of people living throughout the county who need all of our help. And so we want to reach out to the parts of this county where it's a struggle for people to come into any of the facilities. There are a lot of acute healthcare needs that are tied to poverty, to being an agricultural community with a transient population. There's a big diabetes problem. There's a big opioid and meth addiction problem. There are lots of health issues tied to it being the 6th poorest county in the state. Even with Monterey and Carmel and the peninsula, it's still the 6th poorest in the state. And it's geographically huge. So there are a number of programs that reach out to those communities to forestall their need to come to the hospital. We have a diabetes program to intervene with families and especially with children, get them to eat better, to exercise more, and to build a lot more education and awareness around the issues that lead to diabetes. And we are also sending nutrition coaches and nurses out to work with schools and work with families to provide education on those topics as well. We are stepping into, in a major way, addressing the opioid addiction problem. We have a program called Prescribe Safe, which is really coming up with alternative ways to manage pain that aren't narcotics-based. You know, our homeless population is much larger than anybody would think. So the hospital built a mobile health clinic, and it's a converted RV, basically, that has 2 exam rooms. It's literally going out into the community to provide urgent care.
Great, let me get your wristband on.
The idea is if we can get the homeless in the cycle of taking care of themselves in a better way, they don't end up in our emergency room. We'll be able to meet their urgent need on site, but then the idea is to direct them to other kinds of care that they need for the longer haul. And so we'll be going to communities in Seaside and Marina, and then ultimately out towards Salinas, King City, and some of the other areas of the county. Community Hospital is a world-class healthcare institution. They are at the tip of the spear technologically. They're bringing the finest doctors and nurses anywhere in the country and even the world here. But one of the challenges is real estate prices are extraordinarily high in comparison with the rest of the country. The sticker shock for people coming here and establishing a life and a practice is extraordinarily hard. So Montage took the step to buy an apartment building in Monterey in order to provide a subsidized entry gate, if you will, for these people to be able to come and start their lives in their practices. It's a 32-unit apartment building right on Lighthouse Avenue, and it will make a very easy transition into the community for medical staff for whom it might be impossible otherwise. Like people, like families, organizations like ours also have dreams and aspirations. And with the help of the community, we hope to launch innovative programs to address specific populations and specific needs. Some of the ideas are a comprehensive healthcare center for women. Rather than focusing on a specific kind of healthcare for women, whether that's breast health or OBGYN care, we're going to handle the whole spectrum. If you're 11 years old, right up through end of life, if you're a woman and you have a healthcare need, you can come to this one center and we can take care of that for you. So that's one. We're looking at the healthcare needs of kids and adolescents beyond just preventive pediatric care. Specific healthcare needs beyond pediatrics when kids become adolescents and teenagers and even post-teen years. You know, young people, we find out more and more, don't really stop developing as young people until they're in their 20s. We would have a place for people to know that they can go. Now, not all the services may happen in that center. Some of them are clearly going to happen in the hospital or maybe one of our wellness centers in Marina or in Salinas. But we want the community to know that if you have a teenager that needs something, call this one place, come to this one place, and then we'll direct them wherever they need to go. We want to remove the guessing game for them. That we want to be the place where they know they can go to start. right? And that's the biggest hurdle. We care about the people that live in this community, regardless of their socioeconomic status. They live here in Monterey County. We want to help take care of them.